Okay, so yes, welcome to our meeting between the JI participants, University of Michigan, and the Peking University People's Hospital. We'd like to welcome Dr. Jiye Zhu and Dr. Zhao Li from the #2 hospital to join us. And also we have myself, Thomas Wang, and Xiaoli Wu and Mahesh Kannan, who are postdocs in my lab. We want to review the progress in the Joint Institute project entitled Image-Guided Surgery of Hepatocellular Carcinoma. Okay, so yeah, we first began in 2011. First time we met to discuss potential research collaboration projects. Yeah, so 3 years later, Dr. Li came to collaborate, and this visit greatly accelerated the progress, where we identified GPC3 as a unique target for the imaging and therapy of hepatocellular carcinoma. So Dr. Li quickly integrated himself into the research lab and was instrumental in developing the peptide and its evidence for preclinical use in the orthotopic liver cancer model, where he used his surgical skills and research experience to instruct several members of the lab to perform the orthotopic implantation. Okay, just to summarize, the project was to identify a peptide targeting ligand specific for GPC3. This target is highly overexpressed in HCC, which is a very important problem in China and is a growing problem in the US. A biochemical structure is shown here, where we have labeled the peptide sequence with IR-800, which is a near-infrared fluorophore. Currently in China and in many other countries around the world, they are performing image-guided surgery of liver cancer with radical resection using indocyanine green, or known as ICG. This contrast agent is non-specific, so it does not bind to the HCC in a specific manner, and the background from this contrast agent is very, very high. In addition, the ICG has to be administered 2 days prior to the surgery, so the half-life is very, very long. Our innovation, which is the GPC3 peptide, linked with IR-800, also produces near-infrared fluorescence. However, it is very, very specific to the liver cancer, and the uptake is very quick, less than 2 hours. And the background is very low. Dr. Zhu and Dr. Li perform validation of this ligand with immunohistochemistry staining at the #2 hospital, and some of the immunohistochemistry results are shown here. Okay, so how we do better by working together? We have identified the strengths of Michigan medicine by using our expertise in phage display technology to select a unique peptide that binds to GPC3. This sequence was optimized and validated in vitro with cells and then in vivo with a orthotopic HCC xenograft model. Here's some results shown to the right. The HCC is shown on ultrasound. This is in a preclinical model or mouse model of HCC. It is also detected on MRI. And then when you expose the abdomen, you can identify the HCC, the primary tumor in the liver of the mouse. However, with the peptide, we can see the tumor with the bright near-infrared fluorescence. And the advantage of using the targeted image agent is that there may be satellite lesions or lesions that you may have been missed in the human patient. in the background of cirrhosis where the targeted agent may identify. And note that the background is very low, much lower than what would be expected with ICG. Strengths at Peking University include Dr. Zhu and Dr. Li's expertise in surgical implantation of patient-derived HCC tumors, particularly the PDX model, and the opportunity to clinically translate the results of this research into clinical practice, using it as a tool to improve the accuracy of the resection for primary HCC in a clinical setting where the availability of livers for transplant is limited, and there's a greater need for improved surgery, tools for surgery to improve the patient outcomes. Okay, so this peptide was patented not only in the US, but also in China. And we are hoping to license this patent to a pharmaceutical company in China to further advance the clinical translation of this technology for use in human patients. In addition, this project led directly to a NIH-funded grant, U01, and participation in the NIH-funded Center for Translational Liver Consortium. And this further advances the JI-funded program. Okay, so at this point, I'd like to turn it over to Dr. Zhu and Dr. Li. Perhaps you can add some additional insights into the project, its potential use and impact to further advance the therapy and management of HCC in China.
It's my pleasure. I have a very pleasant work with Professor Tom, and we know each other for maybe 10 years. And Professor Tom has come to Beijing, visited the hospital many times, and I also visited Professor Tom's lab in Enable. And also Dr. Li of our team has worked in Professor Tom's lab for 1 year. So that's greatly promoted the progress of our project.
Because I am Dr. Li from the Peking University People's Hospital. Yeah, just like Professor Tom's introduction, I spent a very pleasant year in Ann Arbor, and I learned a lot about the high advanced clinical translational experience. And from about 5 years as we started our collaboration, we found we focus the biomarker of the HCC, because HCC ranked the 5th in China, the lethal molecular tumor. So it's have a very high unmet clinical need in the clinical practice, because lots of people may be suffer from a recurrence. So the prognosis is very, very dismal. So we are trying to use the imaging guided surgery to elevate the radical resection rate. So especially in the very like the cirrhosis background. So we screened several biomarkers. Then we found GPC have a very higher specificity and sensitivity. So it's a good ideal candidate for the HCC molecular imaging. So we screen that and innovate new peptide relying on Dr. Tom's the very rich experience in peptide screening. So then we translated into the clinical use. Like usually we use ICG for fluorescein imaging in the liver resection. You can see I'm just came up from the liver resection surgery from OR now. So, but ICG is not specific. So we want to expand its use. So we want to more precise to see the tumor. Vividly, we described it as turn on the light of the tumor. Yeah, so it's very, I mean, for me, it's give me a lot of clinical driven need to progress this project. So we finally validated in the PDX model, in the organoid model. So next move, just like Professor Tom said, we will try to expand our collaboration in the clinical trial, because Peking University People's Hospital have a very clinical resources. So we have lots of HBV related HCC patients. So it's a good resources, a well-organized biobank for us to further our collaboration. So I have confidence of deepen our collaboration and have a very, I mean, brighter future. Yeah, that's what I saw. Yeah, thank you.
Okay, so we look forward to continue to collaborate with Dr. Zhu and Dr. Li at the #2 hospital, even beyond the funding of the JI project, through continued clinical translation of not only the GPC3 peptide, but perhaps new targets and new peptides for the early detection, image-guided surgery, and therapy of HCC.